Hello, hello. It is that time. I am Dr. Ashley Booth, and I said that I was going to come to you guys and bring you some more information to make sure that you are well. And so today, what I really wanted to talk about and what is a really big thing to kind of set the foundation for everything is preventative medicine. And I've had a lot of people say, well, what the heck is it? And then some say, like, how does it affect me? Like, what's the big deal? So, the thing with preventative medicine, preventative care, doing some prevention, basically that's its goal is to prevent things from happening. And what you want to do is how we do it from a physician standpoint are your screenings. So you have your annual screenings. Now, this could be happening during your what you call your wellness exams. Some people still call them their physicals, some call them their annual exams. Any of those that you have, if you go to your doctor at least once a year, you should have certain screenings that happen. And these screenings are happening at a certain age or if you fit into different categories. So, the type of screenings that you can expect is like for men, there's the PSA, and that's checking your prostate. If you are a woman, you have your mammograms, but then there is also your pap smears because that is checking for breast cancers, cervical cancers. There's also colonoscopies. So you have all these different screenings that we do. The other thing that people can do is look at like your blood work. So, do we see that you are at risk for certain types of diseases such as diabetes or thyroid or even cholesterol? If you have a family history of some of these things, or if you are at risk for these, then those are some types of screenings that we do to see what's happening and what's going on. And so I have patients that say, but why do I need to do it? Because I feel perfectly fine. The thing is, you can feel perfectly fine and could be a disaster, a whole type of situation, storm, whatever you want to call it, could be brewing inside and you feel great. For instance, what I tell people is you have your car and your car has all these different lights on it that tell you that something is going on and you need to check it out. And the good thing about the car is you see those lights and you can either take heed and do something about it or you can just ride it out. Well, the same thing happens with us. Well, you don't necessarily have those little lights that come on. So, what we do is we go ahead and do those different screenings to see if that thing is going to light up and if it's going to tell us, okay, now it's time for us to do something. We need to intervene. Because what happens is these things are going to prevent some situations that can go along down the line. So, how can it prevent things? For instance, it can help you with cost because if we don't catch it early enough, then we're catching it much later. When it's later, then that means that we have more extensive treatments that we have to do, things of that nature, which can become pretty pricey. The other thing is longevity in your life, in your lifestyle. If we catch things early enough, we can intervene early enough, we can get those things under control early enough, which means that now you have a longer lifespan and you're able to do the things that you want to do when you want to do it. A good example of this is it is September, and September is Prostate Awareness Month. So the mayor of Savannah actually just came out and he announced that he was diagnosed with prostate cancer in 2020. And the reason why he came out was because he want people to go ahead and get the screenings because what happened with him, he was not symptomatic at all. He didn't have any symptoms, nothing was going on. His doctor did those screening tests that I talked about. So his doctor did a PSA. Those numbers came back elevated, said, let's do some additional testing. When they did the additional testing, found out it truly was cancer. And then he had a list of treatment options that were available to him because that's the other thing you have to think about. The sooner that we catch it, you have a lot more options available to you and you're able to kind of pick and choose sometimes. Okay, I'm going to do this versus that. If it's caught much later, sometimes those options aren't as prevalent, and then we say, okay, this is what we got to do and we got to do it now. You don't really have any kind of recourse on that. But for him, they caught it early. He was able to get treatment. He's doing much better. But the reason why he shared it is because he said, you know what? People need to know how important it is to get screened for this. And so not only do you need to get screened for that, there are a lot of other different diseases that are important that you should get screened for. So when you go to your doctor's office, you go for those wellness visits, those annual exams and stuff like that. Look and see what they're checking. What blood work are they checking? Did they send you for any imaging, any type of screening things? Those are the things you need to be concerned about. And then look and say, okay, what does that mean? Now that I have these results from it, what does that mean? Because I've had several patients that come to me and they said, oh, they told me everything was fine. Well, what was fine? Because I don't know what was fine if I don't know what was checked. So I need to see everything that was done. So then I know, do I need to do anything else? Is there anything else that's outstanding that needs to be taken care of? So when you go, be proactive. Find out which screening tests are they going to do, which labs are they going to do, follow up on those results. If you don't hear anything, don't just assume, oh, everything must be normal, everything must be fine. No, give them a week or two to get those results back and to review them. If you haven't heard anything, reach back out to them. Some offices will tell you, give us at least 2 weeks. If you haven't heard anything, reach out. So I encourage you to do the same thing. Go to that office visit, talk to them, get that information back, review it. If you have questions about it, then talk to them. What does this mean? What's the next step? What do I need to do? And so, what I'm going to do for you is I'm going to create a checklist of things that are important that you need to look at, that are appropriate screenings, things that you need to look at that can help with prevention so that you can be well over time. So, I want you to take a look at it, go through that checklist. Does this apply to me? Is this something that I need to do? Is this something that I need to discuss with my doctor? I had this done this time. When is it time for me to redo it? Because there are some tests that need to be repeated every so often. So you also need to be mindful of, when was the last time I had that done? Because I had that done at this time. Now I need to get it done again, because what I find out is time gets away from us. It gets away from a lot of us. I've had patients say, oh, I had that last year, and then I get their records, and it's actually been 2 or 3 years since that's been done. It's like, oh man, I didn't realize that. So keep track of those things that you're supposed to get done. When was the last time you did it? And when is it time to do it again? So again, I'll provide you with that checklist so that you'll have what you need. If you have any questions about it, feel free to reach out and I'll do what I can to kind of assist you with that. Make sure that you link up with the primary care doctor that can do these things for you. A lot of people see a lot of different specialists, but your primary care doctor are the ones who are essential in taking care of this information and getting these different types of tests and screening things done for you. But that is all that I have for you today. I hope that you are doing well. Stay safe. And until I see you again, be well.